Hey everyone, welcome another lecture. Which of the following statement relating to the cerebrospinal fluid is untrue? That means, in case of cerebrospinal fluid, which is present in the brain and spinal cord, which is statement is false. So first of all, in the options, choroid plexus only present in the lateral ventricle. CSF volume is 100 to 150 ml. CSF pressure is usually 10 to 15 millimeter mercury. The cerebral aqueduct connects the third and fourth ventricle. Foramen lusca, they are paired and lies laterally in the fourth ventricle. So we have to know details about the cerebrospinal fluid, about their circulation and absorption also. So this is the circulation of the cerebrospinal fluid. The cerebrospinal fluid is formed from the choroid plexus of the lateral ventricle and all other ventricle also, but most of them are released from the lateral ventricle. So when CSF produced in the lateral ventricle, from the lateral ventricle it enters the third ventricle, from there fourth ventricle, and finally subarachnoid space in the brain and spinal cord. But here a few important point, very important, that the lateral ventricle, from the lateral ventricle to the third ventricle, there is a foramen, which is the foramen of the Monro. So foramen Monro, it present between the lateral ventricle and third ventricle, and from the third ventricle to fourth ventricle there is the another opening, which is the cerebral aqueduct. So from the third ventricle to the fourth ventricle, the foramen present, which is the cerebral aqueduct, and from the fourth ventricle to the subarachnoid space of the brain and spinal cord, the foramen is the foramen magendi and foramen lusca. Here we can see the foramen magendi and foramen lusca. So these four important foramina is very important regarding the exam purpose. First of all, foramen Monro, foramen cerebral aqueduct, foramen magendi and foramen lusca. The foramen Monro, they are one in number, aqueduct one in number, foramen magendi one in number, but the lusca, it is two in number, and they present on either side. Here the CSF of cerebrospinal fluid, the space between the arachnoid matter and pia matter. That means the cerebrospinal fluid, it is located between the arachnoid matter and pia matter, and this space is known as the subarachnoid space. And the volume of the cerebrospinal fluid, it is the 150 ml. So volume of the cerebrospinal fluid, it is 150 ml, and it is produced from the choroid plexus of the different ventricle and also from the lining epithelium of the blood vessels. So cerebrospinal fluid, it is not only produced from the choroid plexus of the ventricle, but also it is produced from the blood vessels, and it is reabsorbed in the arachnoid granulation in the venous sinuses. So finally the cerebrospinal fluid, they are released in the venous sinuses by the arachnoid granulation, because every day about 500 ml of cerebrospinal fluid is produced, but usually present in the brain 150 ml. So rest of the fluid should be removed from the brain to prevent hydrocephalus or excessive pressure by the cerebrospinal fluid. For this condition, they are reabsorbed in the different type of sinus in the brain through the arachnoid granulation. The circulation again, first of all lateral ventricle, then third ventricle, then fourth ventricle, and finally subarachnoid space. But there are four type of important foramina from third to fourth ventricle, from lateral ventricle to third ventricle. It is the foramen of Monro, from third ventricle to fourth ventricle, cerebral aqueduct or aqueduct of Sylvius, and from the fourth ventricle to subarachnoid space through the foramen magendi and foramen lusca. And finally it is reabsorbed in the venous system and enters into our systemic circulation by arachnoid granulation, mainly in the superior sagittal sinus. Now the composition of the cerebrospinal fluid: glucose about 50 to 80 milligram per dl, protein which is 15 to 40 milligram per dl, red blood cell they are usually nil, that means the RBC usually not entered into cerebrospinal fluid. RBC they are confined within the blood vessels in the systemic circulation and within the brain substances, but they are not present in the CSF. And white blood cell 0 to 3 cell per cubic millimeter. So finally our answer is ready, which is not true regarding the cerebrospinal fluid. The choroid plexus only present in the lateral ventricle, it is false, because the choroid plexus it present also the third ventricle, fourth ventricle also. CSF 100 to 150 ml, it is true. CSF pressure 10 to 15, it is also true. Cerebral aqueduct it connects between the third and fourth ventricle, it is also true. Foramen lasca is paired, that means it situated either side of the fourth ventricle here. So the foramen, only the false option is the only choroid plexus only present in the lateral ventricle. It is not true, because the choroid plexus present all other area like the third ventricle, fourth ventricle.